Hello guys, welcome to this short video looking into screening for non-MSK pathology in a patient, especially a female patient who comes to clinic with chronic groin pain. Recently I had a female patient who came to me with all typical signs of intra-articular pathology, but she also had other symptoms, and I referred her to a women's health physio, and eventually she was diagnosed with endometriosis. So this is something which can overlap in your presentation, and that can be quite tricky. So for purpose of video today, I'm going to focus on one of the common conditions which can present is endometriosis, and there's a fantastic review article on BMJ. I'll put the links at the bottom of the video where they have highlighted where it's easily missed in primary care. So it's an excellent, highly recommend an article to be for all MSK physios. So there's been a growing emphasis on endometriosis. So what's endometriosis? It's a condition where the endometrium, which is a tissue similar within the lining of the uterus, grows outside, causes pain and discomfort, and can have a big effect on a patient's mental health and quality of life. Unfortunately, endometriosis is often underdiagnosed or misdiagnosed due to lack of awareness. And like for me, I didn't really know this till a couple of years ago, even though I've been dealing with hip and groin for a while. So this article discusses the condition, sort of looks into the pain presentation, and I'll go through all that in detail, and also looks at having an increased awareness of picking this up in primary care, especially if they come with sort of lower abdominal pain, pelvic pain, or groin pain as well. And of course, more research is needed for improved diagnosis, treatment, and also support. The symptoms are generally can be quite non-specific, because you can get abdominal, pelvic, groin pain associated with the menstrual cycle, and also pain during sexual intercourse as well. And I'll go through some of the key points shortly. So what are the key signs and symptoms? So this is taken from the NICE guidelines. So if you having patients, young female coming with chronic pelvic pain, so this is sort of the screening questions which I generally ask for, looking at period-related pain, if they're affecting daily activities, pain during sexual intercourse, pain which is cyclical, and also blood in the urine or pain passing urine, and it's also linked with the infertility as well. So this is something to be screened. So for me, one of the key things which I sort of emphasize on the 2-day hip course is how to effectively screen for red flag pathology, both MSK, but also knowing how to rule out non-MSK pathologies, especially in female with urogenital, and also in men as well, because some of those prostate issues and other issues can also masquerade as well. So that's something which we need to be highly cognizant of when you're dealing with this area. So what are some of the practical implications which I took after reading that excellent review article? So first thing is, definitely we should consider endometriosis as a possible diagnosis in women of reproductive age who present with chronic pelvic pain, groin pain associated with menstruation, sexual intercourse, urination. The second thing is to be aware is the diagnosis can be quite tricky, and it can be missed. So a normal pelvic exam or even a pelvic ultrasound doesn't exclude endometriosis. So if you suspect endometriosis, consider referring to a specialist. So it depends on your setting. It could be a general practitioner, it could be pelvic health specialist physio, or could be gynecologist, where they can explore and confirm the diagnosis, and also look on appropriate treatment as well. And the fourth point, which was highlighted in the article, was being aware of cultural barriers, which can make it quite difficult for patients to seek help, and also to get them appropriate treatment as well. So that sort of is a brief video looking into some of the non-MSK pathologies. We cover quite a bit on our 2-day hip course. So we've got a few dates coming up in London, in Belgium, and in Dubai later this year. So I'll put the links for all the courses and also the book. So thanks for watching. So again, something to look for, especially if you got a female patient with chronic pelvic pain. That should be something we should all be screening for, especially with the checklist given by the NICE guidelines. Thank you.